for the titration. The lengths vary from 20.5 millimeters to 30 millimeters, and sizes are written on the side of the holder and on the rods. The difference in size between each of them is 0.5 millimeters. Unless your dental provider specifies otherwise, ensure the rods are the same length on each side of the device. The length of the provided rods can be changed to increase or decrease the patient's protrusion. Shorter rods move the mandible forward, whereas a longer rod will move the mandible backwards. To detach the rods, start with the upper attachment, preferably the one close to the left canine. Place the side of the upper splint perpendicular to the lower one in order to align the shapes of the rod and the anchor. Then pull to dislodge the rod. Then rotate the rod towards the back of the lower splint to align its shapes with those of the lower anchor and dislodge the rod. Rotate the upper splint towards the back completely to align the head of the right rod and the anchor of the lower splint and pull to dislodge the rod. To finish, align the rod with the upper anchor to dislodge. To insert the new rods, make sure they are the same lengths. First, place both rods on the lower splint. Start by aligning the shapes on the rods with the cutout shape on the lower anchors to insert them. Rotate them towards the front to lock the anchor mechanism. On one side only of the upper splint, insert the shape on the rod into the cutout shape of the upper splint anchor. Rotate the upper splint to lock the anchor mechanism. Place the unattached side of the upper splint perpendicular to the lower splint. Move the unattached rod while holding it firmly between the thumb and the forefinger to align the head of the rod with the upper anchor. Apply the necessary pressure to insert it and bring the splint back to its final position.